Monkeypox is a rare zoonotic viral disease that belongs to the Orthopox virus genus, which includes smallpox and vaccinia. The disease was first identified in 1958 in monkeys in Africa, and human cases were first reported in 1970. Since then, outbreaks of monkeypox have occurred in several African countries, and sporadic cases have been reported outside of Africa. In recent years, the disease has emerged as a global public health threat, particularly in Central and West Africa. This review article provides an overview of the current knowledge and research on monkeypox, including its epidemiology, clinical features, diagnosis, treatment, and prevention. Introduction. Monkeypox is a viral disease that is transmitted from animals to humans, primarily through contact with infected animals, such as rodents or monkeys, or with their bodily fluids or contaminated materials. The disease is characterized by a febrile illness with a rash, which may progress to severe disease, particularly in immunocompromised individuals. The disease was first identified in monkeys in 1958 in Africa and was subsequently found to infect humans in 1970. Since then, several outbreaks have occurred in Africa, and sporadic cases have been reported in other parts of the world. In recent years, the disease has emerged as a significant public health concern, particularly in Central and West Africa, where outbreaks have been reported with increasing frequency. The aim of this review article is to provide an overview of the current knowledge and research on monkeypox, including its epidemiology, clinical features, diagnosis, treatment, and prevention. Epidemiology. Monkeypox is endemic in Central and West Africa, particularly in the Democratic Republic of Congo, DRC, where the majority of cases have been reported. The disease has also been reported in other African countries, including Cameroon, Central African Republic, Ivory Coast, Liberia, Nigeria, Republic of the Congo, and Sierra Leone. Monkeypox outbreaks have occurred in both rural and urban areas, and the disease has been associated with high morbidity and mortality rates, particularly in children and young adults. Clinical features. Monkeypox typically presents with a prodromal phase of fever, headache, muscle aches, and fatigue, followed by the appearance of a rash, which progresses to papules, vesicles, and pustules. The rash usually begins on the face and trunk and then spreads to other parts of the body. The clinical course of monkeypox can vary from a mild self-limiting illness to a severe and life-threatening disease, particularly in immunocompromised individuals. Complications may include secondary bacterial infections, pneumonia, and encephalitis. Diagnosis. The diagnosis of monkeypox is based on clinical features, epidemiological history, and laboratory confirmation. Laboratory tests include virus isolation, polymerase chain reaction, PCR, and serological testing. Treatment. There is currently no specific treatment or vaccine for monkeypox. Supportive care is the mainstay of management, which includes management of fever, pain, and prevention of secondary bacterial infections. Antiviral therapy, such as cidofovir and brincidofovir, may be considered in severe cases. Prevention. Preventive measures include avoiding contact with infected animals or their bodily fluids or contaminated materials. Vaccination against smallpox may provide partial immunity against monkeypox, and recent studies have shown that the current smallpox vaccine, ACAM 2000, provides cross-protective immunity against monkeypox. Conclusion. Monkeypox is a rare but potentially severe viral disease that poses a significant public health threat.